Hello, this is Jeff Bellinger here for another 2-Minute on Tuesday. It's Tuesday, August 18th. Hopefully this video finds everybody safe and healthy. Got about a month left of official summer, so hopefully you're taking advantage of it here before the fall starts end of September. As I mentioned last week, I found an interesting article about COVID-19 and the limitations of fully health insured plans. I'm actually going to link you to the article. Most of you probably haven't seen the article because it appears in a trade magazine or website that health insurance professionals mostly are hooked up to, so you're probably not seeing it. I don't think the article is getting picked up anywhere else, but it's an interesting article. There's actually other articles written on the opposite side of things, but it's interesting and it made me wonder, so I went and looked. Many of you know we have an administrative firm that administers plans nationally for not only our clients, but clients of other brokerage agencies throughout the United States. We have several hundred companies that we do FSA and HRA administration for. At Better Business Planning, we have an HRA plan for our employees. We take one of the high deductible plans and we bring the deductible down considerably, and we pay those expenses when they occur during the deductible that we want to create and the deductible that Blue Cross Blue Shield has on the plan. We've been doing that for our groups for probably 15 plus years now, and it's very interesting because it allows us to see data that you wouldn't see as a normal fully insured client. Through our plan alone, I just went quickly and looked at what our expenses were, and they've dropped by over 30% during the time from April till now in comparison to last year and the prior year. And then I piqued my interest, so I went to the close to 500 or 600 different companies we did, because I did it on combined FSA and HRA. And I was looking at what was funding during January and February, and I have numbers that were funding in January. We were funding about 1.3 million in January. In February it was 1.28 million, so it was similar. So the usage of plans was continuing along. I cut March out because it was kind of a mixed month where everything started to occur, and then in April, I took a look at the expenses of the plans, and it dropped to $832,000. May was at 1 million, June was 795,000, and July was 973,000. So I'm seeing the same drop, that similar percentage drop that we're seeing, maybe actually a little bit higher than our own small plan where we only have a handful of people on the plan. But it highlights what this article is talking about, is that the fully insured, if you're a fully insured client, you're not going to see these numbers. And come renewal time, if you just are looking at the fully insured numbers, you know that many of these plans are going to want an increase going into the new year, and many of your plans are renewing at the end of this year. So there's a couple things to keep in mind. Talk to your benefit consultant. You certainly want to look at, there's been a lot of opportunities to save dollars by using some of this simple self-funding, as we call it, where you simply take a robust medical plan, buy the highest deductible option they have, and then choose the benefit levels that you want to choose from. There's also been a lot of companies that have come out with what they call minimum premium or alternative funding, or some people will even call it fully self-funding. It's a lot more easy to understand for smaller companies the way these new plans are out there, and a lot of the companies that we have with them are seeing dollars coming back to them because of the savings that these plans generate. So as you approach the new year, look at this article. We're going to put a link to it, and if you want to learn more about some of the options that are out there to control the health costs, feel free to reach out to me. We'd be happy to help you. Otherwise, enjoy the week, and we'll talk to you next week. Thanks.